I think many are still coming in, but I wanted to welcome you all and thank you for joining us. My name is Sarah Anderson, and I'm honored to serve as Executive Director of the Bay Area Global Health Alliance. We are a global health community with 70 member organizations, academic institutions, NGOs, and nonprofits, tech, biotech, and other private sector companies, all committed to working together, building connections across the sectors, and sharing knowledge to advance global health equity and innovation. We are pleased today to partner with our members, Americares, Google, Public Health Institute, Stanford, and UCSF to bring you this online conversation.
Hi, everyone. I'm Alexandra Dessler, Americares Northern California Regional Director. Sarah Anderson's going to hop back in. She's having a little bit of technical difficulty, but we're so excited to have all of you with us today. Americares is a health-focused relief and development organization whose mission is to save lives and improve health for people affected by poverty or disaster. Each year, Americares reaches 90 countries on average, including the United States, with life-changing health programs, medicine, medical supplies, and emergency aid. Americares is delighted to be an Alliance member and partner, bringing you this timely conversation as California is enduring scorching temperatures this week. We have a fabulous lineup today of cross-sector speakers who will share data, innovative tools, and insights into the human health effects of wildfires and air pollution, particularly with respect to those most vulnerable. We'll also hear a lot about climate resilience today. On our panel, Gina Solomon, Principal Investigator, Public Health Institute, and Clinical Professor, UCSF. Paul English, Director, Tracking California, the Public Health Institute. Lisa Patel, Clinical Assistant Professor, Pediatrics, and also Deputy Executive Director, Medical Society Consortium on Climate and Health at Stanford University. My colleague, Kristen Stevens, Director, Climate and Disaster Resilience, Americares, and Kevin Holst, Social Impact Partnerships, Crisis Response at Google. With that, I'll turn it over to you, Gina.
Thank you so much, Alex. Great to be here with you all. Difficult times we're facing. We're focused today on wildfires, and that's for good reason. There are 7 major fires currently burning in California, in Northern California, and a forecast for high winds and dry lightning this coming weekend. So there's a lot of concern. We are certainly not out of the risk season yet for wildfires this year, and the current heat wave is setting the table for very dry conditions in the forest lands and grasslands of California. So I'm going to just introduce the issues around wildfires and health. And let's go into the next slide and talk first about just the immediate effects. We're mostly going to be talking about air pollution in this panel, but I have to acknowledge the people who died, 87 people who died in the Camp Fire in 2018 in the town of Paradise and surrounding communities. Some of these people, their photos are here, and we remember them, and we realize that people are dying this year as well in wildfires. And the people who die tend to be people who have difficulty getting out of there in time. Sometimes it's bad luck, but sometimes it's vulnerable populations, elders, people with disabilities, people who have unreliable transportation, even people who don't want to leave their animals behind. And so these are all things that we need to be thinking about and preparing for so that we don't lose so many lives in wildfires. In the next slide, I just want to focus on some of the air pollution effects of wildfire smoke. This affects a far greater geographic area. And so, the health effects hit large population centers. You can see here again from the example of the campfire, the smoke plume shot like a fire hose jet, except it was smoke hose, directly at the Bay Area, and subjected those of us in the Bay Area to extremely high levels of air pollution. And as you can see, when you think about what's in the smoke, there's obviously burning vegetation, burning wood, but a lot of other burning things, burning homes, burning vehicles, burning tires, and a lot of burning plastic. And that does change the composition of the smoke. And the next slide talks a little bit about what's in that smoke. And so the combination includes particulate matter, but also a whole set of noxious hazardous air pollutants, including things as toxic as hydrogen cyanide, which is why so many people die near the fire. Even if they are not actually burned, the smoke inhalation is terribly dangerous. You can see, though, from the bar chart on the right, that's just to give you a sense that with over time and distance, as the smoke travels over about a 3-day period, the concentrations of these hazardous air pollutants declines a lot. So the main thing that we're dealing with when we're far away from the fire and breathing the smoke is that particulate matter, which is tiny, gets deep into the lungs, causes incredible inflammation, and promotes clotting, which can result in some of the health effects we see on the next slide. Which includes, a lot of respiratory effects, asthma exacerbations, bronchitis, and even links between particulate matter and both illness and death from COVID. But there also are all these other health effects to think about, mostly cardiac, but also stroke, that are due to some of the indirect effects of the air pollution on clotting pathways and inflammation in the body. So a lot of different kinds of things that can end up putting people in the emergency department of the hospital, or killing people from breathing smoke. In the next slide, I want to emphasize some of the populations that are at highest risk. And these include populations we're going to be talking about, I think, a lot of the presentations today. Older folks, children, people who are pregnant, are because particulate matter actually has significant impacts during that time period, as well as people with underlying health conditions. I also want to focus on a project that I'm currently working on with our next speaker, Paul English, in the Central Valley. A lot of people who are also outdoor workers, usually farm workers, also don't have air conditioning systems in their homes. They have swamp coolers or evaporative coolers. These devices, not only are they less effective at cooling, they also pull in large quantities of unfiltered outdoor air into the homes. And so our farm workers are not only being exposed in the fields, but they're being exposed in their homes, they and their families, and facing impossible choices when it's hot and smoky. If they turn off the swamp cooler, it's unbearably hot. If they turn it on, it's unbearably smoky. So there's a huge need to address some of these structural problems in the state in order to increase our climate resilience. So let's go to the next slide. Just want to mention the heat wave and acknowledge the fact that that we're dealing with horrendous heat, but also acknowledge the climate projections. You can see in the small chart on the right of the slide, we're dealing with heat now. We're going to be dealing with many, many more days each summer like this going into the future. And so this is really our reality going forward. And heat is the #1 cause of weather-related deaths, according to the National Weather Service. If you're out in the sun, it increases the heat index feeling considerably. So people who have no choice but to be outside are facing the greatest risk. And you can see from the list of health outcomes, there's a lot of overlap. with wildfire smoke. And we may talk more about that later, but I do want to acknowledge that the populations that are most vulnerable and the kinds of health effects you see from heat and from wildfire smoke overlap. So on the next slide, I think that's just about it. I just wanted to put up a few resources. Everybody should be familiar with the Air Quality Index. It's a really useful way of just quickly communicating and understanding how bad the air quality is out there and who needs to really pay attention and take precautions. Then for those of you that really want to have access to the information at all times, and I have all of these, I have to confess, at airnow.gov or the AirNow app. It's really useful for local information. The Smoke Sense app will give you specific wildfire smoke information. The Purple Air Network is great, though I'm not as thrilled about their app, but on your computer, it's a great resource. And then we should all sign up for Nixle alerts so that we can be informed, for example, about heat waves and smoke events. The OSHA, if you Google OSHA heat safety tool, you'll find a really nifty app that'll give you information about the heat conditions at all times, including things like humidity and the additional heating from the sun. So that's all I have for now, and I want to hand it off to Paul English, who's going to talk about some strategies for monitoring air quality in local communities. Paul.
Thanks, Gina. So I run a program called Track in California, and we do environmental health research and surveillance. And I want to talk to you today about this project we did down in Imperial County. I'm going to show you in a second where that is. And looking again at particulate matter, and I want to show how this project can improve neighborhood community resilience and in turn be related to climate resilience. Next slide. So as Gina's mentioned, and as she already went through some of this, so I'm not going to spend much time on this, but wildfires are a major source of particulate matter. And as far as climate change, it's a little bit hazy on what is going to happen with particulate matter levels. They'll be affected by changing weather patterns. There may be more stagnation, weather events. There could be heavy rain. All these could affect particulate matter. But we do know that particulate matter has significant public health risks, including premature death from heart and lung disease. Next slide. And I think this is a great slide that just shows you, and Gina mentioned how small it is, but this might give you a better idea. So if you can think of this as a human hair, and there's two types of particulate matter we normally look at. One is more of a coarse one, which is PM10, which is 10 microns in diameter, and then the one at the top, 2.5 microns in diameter. And you can see about 5 of those PM10 particles will go across the human hair. And then inside each one of those PM10 particles, you could put 4 PM2.5 particles. So that shows you the potential for that to penetrate deeply into the lung and cause health problems. Next. So here's Imperial County. It's east of San Diego County. This is a mostly low-income Latino community. They have a lot of environmental health hazards. There's something called the Salton Sea that you may have heard of that's in that county that is drying up and can be caught and is likely to cause more dust from the playa as that evaporates. This has been one of the top counties in the state that has had the highest rates of emergency room visits and hospitalizations among children for asthma. And the community's identified air pollution as a priority concern. Next. And here's just some pictures showing, there's agricultural dust, there's international border crossing at Calexico, Mexicali that generates a lot of traffic. I'm showing windmills, which you'd think of nice to renewable energy, but actually the construction of these renewable energy sites, such as windmills and solar facilities, actually disrupt the desert playa, which causes deaths and also causes increased risks of valley fever. And you can also see A couple other notable things. One in the far bottom, they're still doing field burning of crops down there. And also on the left, there's a lot of recreational use of vehicles that is another dust problem. Next. So what we did, and this was, I want to acknowledge we had funding from the National Institutes of Health for this project, but we put together a box in collaboration with the University of Washington that has a microcontroller in it, and it has a sensor that measures both of those sizes of particulate matter. And our aim was to put up a big network of over 40 of these sensors that have wireless connectivity for real-time reporting and custom shelters to protect from extreme weather. And it's common for them to get temperatures exceeding 110 degrees in Imperial County. Next. And what was great about this is we actually used the resources of the community to, there was training, they supported the installation of the monitors. Here you can see pictures at Brawley High School where we put the first monitor, and actually the machine shop helped build one of these boxes. And this really increases community capacity that promotes sustainability of the project, and increase awareness of the issues. Next. So this was our kind of the design of our study. We had community participation structures. We had a community advisory group. We had a technical advisory group. We designed and deployed the air monitoring network. We analyzed interpret the data, and then we display and disseminate the air monitoring results real time on the internet. And then also do some other analysis of the data and implement community action strategies. Next. So here's a picture on the left that just shows the standard regulatory monitors that are run by the California Air Resources Board and the US EPA. And you can see there on the left, those were the only places they were measuring particulate matter. And then on the right, you can see afterwards, we put all those other monitors. You can see a lot clustered down there in Calexico at the international border, and then some around the Salton Sea. Next. And then these data now are displayed in real time on this website, where you can see a map of the monitors. And also we went through a process with the community group to come up with these community air quality levels that were similar to the ones that Gina showed that the US EPA has, but these were a little bit more tailored to just particulate matter and levels that the community was comfortable with. Next. And so these are talking about community resilience. This was based on a literature review that was done on community resilience, and these were some of the factors that they came up as common factors of the definition of community resilience, because this is not a term that really has a standard definition, but these are common themes: local knowledge, developing community networks and relationships, communication, impacts on health, governance and leadership, resources, economic investment, preparedness, and mental outlook. Next. And then this is kind of the results when we did an evaluation of the project. We found there were significant and diverse gains in knowledge and increasing ability to collect and access and use the air quality data, expanded networks. About half of our monitors were installed at schools. And so this increased preparedness among school communities, increased communication about air quality and real-time air pollution events. There was increased government and community involvement and support in planning this and in response to air quality issues. The participants' understanding of air quality and health increased. There were more resources in lots of different sectors in the community, including economic investments in our community partners that went to the health of the broader border community. And the participants did report feeling more empowered, hopeful, and prepared to make a difference. Next. And this one also shows that this was coupled with what we call a school flag program. So what this happened is, this is again at Brawley High School where the first monitor was installed. And so when the students and others that the principals, administration, and teachers that are monitoring the real-time air quality, when they see it's good air quality, they put up a green flag, yellow if it's caution, and then like red flag if it's really hazardous. And this could be used to, shelter students in place, or perhaps change the time or routes you go to school, or maybe use prophylactic use of inhalers or other things that could be done. Next slide. So that's basically it. This is just showing you some of the photos of all the great community involvement that we had, and awards, and the school marching band playing at the unveiling of the monitor at Burley High School. And glad to answer more questions about this. That's it. That's all I had. So thank you. I think we're going to do some questions, or moving on to the next presentation, which might be you, Lisa.
Great. Thanks so much. So it's great to follow Paul and Gina, because I'm going to draw from themes that they both talked about, and I'm going to turn to talking about schools. I'm a pediatric hospitalist and an environmental scientist, and my interest in climate change in schools actually came about in 2020 when schools shut down because of COVID. And so both as a parent of a daughter at San Francisco Unified, as a pediatrician, I got involved. I spent a lot of time doing talks with schools about ventilation because of my background in environmental health. So I talked to schools about their HVAC systems. These are their heating, cooling, and ventilation systems that keep rooms in our buildings cool and free of air pollutants. And schools will look askance at me. We estimate that about a quarter of our schools in California don't even have HVAC systems. I talk about opening a window, more looks askance. Some of our schools have their windows painted shut because they live in over-policed neighborhoods that feel unsafe. And I learned that process, how underfunded our public schools are. Work at Berkeley estimates a $15 billion gap per year in our investment in our public schools. And it explains why our schools are poorly equipped, not just for the pandemic, but for this unfolding climate crisis ahead. Next slide, please. It made me realize that schools have to be a central part of our climate change resilience plans as we think about protecting vulnerable populations. And that's because children, after their homes, children spend the most time in their schools, and climate change is increasingly disruptive to children's environment in terms of learning. Education is supposed to be a right in California's constitution, but between the pandemic and now, more and more because of climate change, we're seeing that right threatened and disrupted. This is data from 2018. We don't have good data from 2020 because school was remote that year when we had also a really terrible wildfire season. But from 2018, you can see how much of a driver wildfires were in terms of how many students were affected and how many missed days of learning. From that year, it's estimated about 1.1 million students were affected. And when we think about what those disruptions from wildfire smoke is, it's safety, it's power outages, and it's because the air quality within the classrooms are so unsafe that schools shut down for that reason. Now, like I mentioned, we don't know within California. California doesn't track this information systematically. There was a national report that came out from GAO that estimates about 40% of schools lack adequate HVAC systems. And like I said, some of the work that we're doing from some informal surveys is indicating about 25% don't have HVAC systems at all. Next slide, please. When we think about wildfires, and both Gina and Paul talked about this in terms of the health effects, there are multiple health effects on children. The one that I worry about the most, I'm a pediatric hospitalist, so I care for children who are sick enough to need to stay in the hospital, is asthma. It is the most common childhood condition. 1.5 million children in California have asthma, and it is a huge driver for health disparities. Black children and Hispanic children are 2 times more likely to suffer from asthma. A Black child is 5 times more likely to be hospitalized as a result of it. And what are the drivers for those disparities? Well, a big one is the built environment in which they live. Our sites of fossil fuel extraction, combustion, and refinement more often happen in communities of color. So we expose children, particularly children of color, to these pollutants from an early age. Now we layer on wildfire smoke on top of it, and we can expect to see more and more kids with asthma and asthma exacerbation that continues to disrupt their learning. Next slide, please. The other point that Paul raised that I wanted to highlight is the other reason why it's so important to invest in the infrastructure of our schools is both to clean the air by putting in HVAC systems, but also to really lift up schools for the sites of community resilience that they are. They are natural organizing points for many communities and have served as sites for emergency preparedness and emergency response during times of disaster. So a lot of the work we're doing to both install HVAC systems and put in solar microgrids to create some amount of energy resilience resilience in the face of power shutoffs that can really lift up schools as a place where community members turn to during times of crisis as well. Next slide, please. The final piece that I just wanted to talk about, particularly as a pediatrician, we have a national emergency on our hands in terms of the status of kids' mental health. This was a story that came out of NPR. That morning, the most destructive fire in California history, the Camp Fire, had caught fire near their home in Paradise. The family resettled at the bottom of the hill in Chico, 6 people crammed into a 29-foot trailer. The middle school that got set up for Paradise kids was not a school at all. It was a big box hardware store that had gone out of business and cold, 59 degrees, everyone in coats. They'd been heating the store with propane, but one day someone smelled gas. The fire department showed up, lots of kids freaked out. Some went catatonic, others called their parents to pick them up. The smell brought them back to the day they'd evacuated Paradise and hearing the sound of propane gas tanks exploding one after another as they fled. After that, the administration just left the heat off. I've worked with school psychologists who tell me that kids will cry and panic when they so much as see smoke in the sky. These events have become so repetitive and so traumatic to our children. And the reason why this is important is that we understand now what the burden of toxic stress means for our kids. Experiencing these kinds of disruption, this kind of trauma from an early age, sets them up for a lifetime of poor health. And so kids, particularly kids that are already struggling with toxic stresses, such as poverty, racism, housing insecurity, when we layer the stressor of climate change on top of it, we are setting our children up for a lifetime of poor health. Next slide, please. So in my work, I'm very lucky to be joined with a wide coalition of partners. We're working with 10 strands. We're working with Undaunted K through 12, with the Green New Deal Coalition. We're putting together this very collaborative policy report on how California can achieve TK through 12 climate resilient schools in California, with the hope of pushing our decision makers to spend every single dollar on infrastructure towards climate resilience and sustainability, and for the state to really step up and provide more in that realm to ensure that our schools are equipped with the tools that they need to keep our kids safe and make schools a site of climate resilience so kids can have a safe and continuous learning environment. And I think it's time for a question now.
Hi, everyone. Yes, I'm going to pose a question for the panel, and then we'll hear the other speakers. How do heat and wildfire smoke interrelate to increase health vulnerabilities, especially for children and pregnant women?
Yeah, I can start. And I think I mentioned I'm a pediatric hospitalist. So I work at Pleasanton. I work in a community hospital there. And I happen to work some very long hours over Labor Day weekend when the heat wave was peaking. It was 112 degrees in Pleasanton one of those days. It was the 2 worst shifts I've had since the pandemic has started. The number of kids that I saw come in with respiratory problems, which we also see during periods of heat. Heat basically drives things like ozone, which can cause asthma exacerbations as well. We know heat in particular also drives poor birth outcomes. We are seeing one of my OBGYN friends, like we have a preeclampsia epidemic right now amongst our moms right now, because we know that prolonged exposure to heat causes preeclampsia in women as well. I had a number of, and the evidence here is a little more mixed. There's something called meconium, which can happen when babies are inside and they poo inside. They can inhale that in, it can damage their lungs. I cared for I had to go to a number of deliveries, and we had a number of infants that ended up in our NICU because of meconium aspiration. So those were some of the things that I was seeing. And the reason why kids are more vulnerable, particularly to wildfire smoke, they spend more time outside, they breathe faster, so pound for pound, they're inhaling more of that pollution. And then children are reliant upon their caretakers to keep them comfortable. The first week of life, there's a higher risk of mortality for newborns because they have poor ability to thermoregulate. And it's not like they can kick a blanket off if they're too hot. So those are some of the reasons why children and babies in particular are very vulnerable to these climate change threats. And I don't know, Gina or Paul, if either of you have additional information you want to add on.
Yeah, go ahead, Gina. I was just going to say, I thought that was really complete, Lisa. I didn't have anything else to add.
Yeah, that was great. And I completely agree. I think, one of the other things is children just have narrower airways. When they get an infection, when they get some inflammation in the airways, they close off a lot more easily than in the adult. And I think that The other thing that we've seen in the epidemiological studies associated with heat in particular is premature birth, which is quite common. So I'm sure that also is something that was popping up this weekend, and it's something that we have to worry about a lot with increased heat over time. And so, but that toxic interaction of heat and smoke is really something that we need to worry about, and thinking about how to protect kids and pregnant women in an effective way through a combination of strategies, and to avoid this sort of catch-22 of having to turn on a cooling device that pulls in smoky air, is something we're going to have to work to avoid going forward.
Great, thanks everyone for those insightful comments. We're going to turn back to our next speaker, Kristen Stevens.
Thank you so much. Yeah, so to build on Lisa's talk, when we talk about institutions within our communities, I'd like to talk about climate resilience and community health centers. So at AmeriCares, we work with community health centers, free and charitable clinics, federally qualified health centers. These are health centers that see uninsured and underinsured patients. They are pillars of their community, and they are seeing patients who are most vulnerable to the impacts of the climate crisis. So we are currently in partnership with Harvard Sea Change, that's Harvard Center for Climate Health and the Global Environment, working on a project funded by Biogen to enhance climate resilience in these clinics and in these communities through a multi-pronged approach. So we are targeting three main audiences in the project. So one, we're looking at providers, making sure that the healthcare providers have the most current information that they need to be able to effectively treat their patients who are suffering from the impacts of climate-related emergencies. So making sure that they know the ins and outs of how to manage different conditions when there's a heat emergency, for example. We have general information about heat impacts on the body, as well as some disease-specific information. And then we also have partnering information to that for the patients, so that patients have take-home information for themselves about how they can best take care of themselves. We know that there are many barriers to care. We know that there are many barriers to effective treatment, but a good place to start is to make sure that everybody has the right information, the information that's appropriate for them. We're working through three main hazard types. So we're starting with heat, which is already published. Next up is wildfire. And then finally, we're going to be doing hurricanes and severe flooding. So we're looking at providers and patients on that clinical aspect of it. But then we're also working on the operational end. So making sure that the clinicians have what they need to make the treatment they need to make, but also making sure that the clinics themselves can stay open as long as possible, or if they have to close, making sure that they can reopen quickly. So making sure that they understand the potential threats facing them, how to mitigate those threats, everything from year-round checklists to enhance their overall resiliency, to checklists for just before an emergency, to what are the best alert systems to monitor, how do they stay abreast of current information, messaging for their patients and communities. It is so hard to develop emergency messaging during an emergency. So we help them with templates to help them figure out what to say and how to say it so that when something happens, they're ready to go. This is an incredibly exciting project for a number of reasons. First, to our knowledge, this is the first of its kind, bringing together that clinical and operational end. And then also it's the first of our kind, to our knowledge, to really focus on these health centers. When we've looked at preparedness overall, so I'm an emergency manager by background, preparedness in the health arena has typically focused on acute care hospitals, followed by other inpatient facilities like nursing homes or skilled nursing facilities. The community health centers are at the vast outer ring of it. They're not given the attention, they're not given the funding. That's not That's not where all of the attention happens. That's not where all of the excitement is. At the same time, that's where the people who are most vulnerable to disasters get their care. And we know that people who are vulnerable before a disaster are even more vulnerable during and after a disaster. So our partnership is helping to bolster that ring with the people who need the help the most. And with that, I would like to turn it over to Kevin.
Yeah, hi everybody. Thank you for the opportunity to share. So before I get into some of Google's products surrounding air quality and wildfires and other natural hazards, I wanted to just share about the role that Google plays in this ecosystem. So Google is great at organizing big complex data and making it visual, accessible, equitable. And so that's what we try to do, especially with our public health and crisis products, as we know that people are looking for authoritative and immediate information. And so why I bring this up is also because the power of partnerships is absolutely key to our work. We use products that have partnerships that are authoritative from many of the agencies that Gina shared as well, like AirNow and Purple Air, Nixle Alerts, and others. So we can go to the next slide here. Great. So one product that I wanted to share about is our air quality products. Again, we try to take these issues of natural hazards and potentially dangerous public health issues and visualize them, make them easy to understand for people in order to have actionable steps. So because of this, we've put air quality on search in a visual way, and then also a new air quality layer on maps. And so people can make decisions that are informed. We can go to the next slide as well. So this is just a few basic numbers on some of the alerts that we do throughout the world. So as you can see, we have our authoritative partners who are sharing about these. We have 3 different types of products within the crisis ecosystem. Before a crisis happens, so floods, flood forecasting, for instance, during an event, maps and alerts, which I'll get into, and then post-disaster analysis as well. You can go to the next slide. And 2 ways that we get information out to the public in order for them to make informed decisions is through 2 different types of alerts. The first is public alerts, and this is where we take alerts. We take alerts from different agencies, sorry about that. We ingest them into our platform, and then we share about these alerts through our products. These are also integrated on other products, including weather. So if you search for weather, we're going to share the heat warning that a government agency is sending. If you search for a fire, we'll also share the air quality information, because we've seen that users, while they're looking for one thing, they're also interested in these connected hazards as well. We can go to the next slide. So as I mentioned, our users really want to see immediate and authoritative information. And during a crisis, it is very important that we share the respective local evacuation information, websites for fire alerts, where to take your animals even. There's all types of helpful information that gets shared that we try to organize and put out to communities that are in danger. So on our SOS Alerts platform, we have a fire boundary map now that visualizes where a fire is based off satellite information, that also goes into maps for navigation information, for instance, as well. Again, this is paired with authoritative information from local authorities. So we can go to the next slide. Great. So this is, again, just our wildfire maps. We've launched it in North America and Australia as well, focusing on a few areas that have had major fires, bushfires and wildfires in the past, to make this information more accessible as our users look for what is happening, where is it happening, how bad is it, and then what do I need to do to stay safe. So that was a few of our products in this space. Happy to answer any questions, but again, just wanted to reiterate the power of partnerships in this ecosystem and the importance of these authoritative sources of information. Thank you.
Thank you, Kevin. That was so interesting to hear what's going on at Google. And thanks to you all. As Sarah indicated, she's having audio trouble. So please do go ahead, and if you have a question you'd like to ask, go ahead and unmute yourself and pose a question for our esteemed panel. I'll get us started. One question for the panelists: how can, as you talked a lot about partnerships, Kevin, how can partnerships help address key challenges in climate and health? And that's for all the panelists.
Yeah, I can answer from our side. So again, partnerships are very important for us as we consider ourselves the disseminator of authoritative information. And so for us, these partnerships are crucial to products, but also the equitability and accessibility of authoritative information.
Great. Paul, do you want to go next?
Yeah, I neglected to mention during my presentation the really strong role of our community partner, the Comité Cívico de Valle that was in Imperial County. And really without them, there would be no project. And, you know, there really needs to be better collaboration between the scientific community and the community itself. And, you know, typically it's been, this kind of relationship has been, you know, via academia with communities, and there's been some issues with that in the past. In cases that there hasn't been a sustainability plan, you know, academics tend to maybe be more focused on publications and not trying to train the individuals and put money and effort into the communications that is needed to work with communities, which you really need to put a lot of time and have the expertise to do those types of you know, translation from the scientific findings and procedures to lay language. So yeah, we just find them very central in our work.
That makes a lot of sense. Thanks, Paul. And Kristen.
Yeah, so at AmeriCares, our work is built on partnerships. We work with local health centers around the world. We have about 4,000 health centers partnered that we're with around the world. But in a sort of a general call for partnerships, you know, in emergency management, we have a saying that when disaster strikes, the biggest challenge is getting big enough, fast enough. Because it's nearly impossible to have all of the resources that you need for every large scale disaster just standing by. The climate crisis is an all hands on deck emergency. We are faced with a situation where everybody has to bring whatever they have, put it on the table, no matter who you are, no matter what organization with you, everybody has something to bring to the table, whether it's through funding support, whether it's through other material support, whether it's through connections, other partnerships, ways that you can leverage influence, the power of your voice, the power of your vote. Everybody has something to contribute. So we won't be anywhere without partnerships, not we at AmeriCares, we as a society. This is an all hands on deck emergency, and partnerships are the way that we're going to be able to rise to the challenge.
And Lisa.
Yeah, I want to plus on that. I think one of the most humbling things about writing this report on schools is that there's for how big and overwhelming this problem is, the expertise does not sit with one person or in one discipline. How many different people with how many different perspectives you need to bring together. And the thing I've learned about it, and I've seen it both in our hospital sustainability programming, and I'm seeing it in the schools as well, everyone does care about this issue. Whether you're in operations, landscaping, food, everybody is worried about this, and for everybody it is applicable. What you need is the work plan, the vision, the team to bring together to give people forum to be able to do something about it.
Absolutely. And we have a question from the audience from the Climate Psychiatry Alliance. This is especially for you, Lisa, regarding school readiness. The participant says, I have a great concern that schools are closing when they cannot maintain safe heat. Seems this is happening in LA, as 600 of 700 schools have inadequate and old HVAC, which you referred to. Keeping kids home where homes are not cool enough for children is not adequate and only shifts the problem. Can you address that?
It is a big problem, and I think that's probably Robin Cooper, if I'm not mistaken. It's a great question, Robin. And I mean, that's why I'm working so hard on this. Is I think it's called the Climate Integrity Project. Actually did an assessment of the entire United States and projected forward into 2050 how many of our schools are going to have to be equipped with air conditioning, and the price tag on that is overwhelming. And the point they were trying to make in their analysis was to say we shouldn't have created this problem in the first place, but now we have this problem and we need to address it. And what we were hoping to highlight, states like California just don't collect infrastructure information in a centralized way to make centralized decisions. And so this has kind of gone on under the radar. The way our schools were built, it was built for a Mediterranean climate, which is no longer the case, to walk from wing to wing when the air outside is polluted and it's really hot. It just doesn't make sense. And so we're going to have to really quickly change the way we do things and make sure that we're investing our dollars wisely for the threats that children face ahead. Because I agree with you, we know that missed days of school, particularly for children of color, sets them up for a lifetime of poor health, poor income. And so it's something that needs to be addressed as the crisis that it is.
Great, thank you, Lisa. And another question, this one from Cindy Wong, who teaches at UC Santa Cruz in the area of environmental justice and global health. And she's interested, wants to be basically using this recording for part of her schoolwork presentations with students in her classes. And she's wondering, how can college students get involved? Paul, do you want to take that one?
Yeah, and Cindy, we didn't, on the Imperial County project, we didn't involve college students per se, but we did have a youth leadership academy for high school students. And we developed a curriculum where they learned about air quality and health. They learned about the mechanics of operating this air quality surveillance system, and a lot of other material related to environmental health. So, and when we did an evaluation of that program, we did find increased knowledge and some other factors such as, environmental health literacy and other things we measured. So I'd be glad to, we had published a manuscript on that, and glad to talk to you more about that or share the curriculum if that's of interest.
Sounds great. Sounds like a potential partnership. Gina,
Yeah.
your hand up. Go ahead.
Yeah, I'd love to just add. I'm thrilled, Cindy, that you're leading this course. It's so needed. There is a UC-wide effort called Bending the Curve that already created a few years ago a curriculum for college students around climate change, and there are health modules and environmental justice modules as part of that. And that's being updated this year. So new versions will be available relatively soon, I believe. So there are resources out there through UC, and also a lot of interest within UC in expanding education around this issue area. And then there are just so many opportunities to do community science with students. We did a project in Ventura County doing heat monitoring in local parks. You can get very inexpensive heat, basically thermometers called iButtons, and students set those up in parks and bus stops all around the community, and documented temperature differences on hot days from parks in higher income community neighborhoods compared to parks in lower income neighborhoods. And those kinds of projects are out there, can be replicated, and it can be really powerful at a community level in terms of driving change.
Thanks, Gina. Kristen, why don't you go ahead and answer the question as well? And then Ernie Chow, you'll be after Kristen.
Thanks. I think for college students, the main thing is there are so many ways to get involved, and find your way. Like Lisa was saying, the answers don't lie with any one person. You don't have to be a STEM major to help turn the tide on climate, right? Find what it is that you do and find a way for you to be engaged. Get involved, understand what's going on in your community. So much of this stuff starts at the local level. Understand your community, understand what the risks are, understand what the hazards are. But everybody has something to contribute, whether you're in history or science or art or music. Everybody, there's room for everybody with this. And I think that's one of the biggest things is you're not left out if you're not a STEM major. You know, they're taking an environmental public health class. That is fantastic. But if that one discipline doesn't become your life's work, it doesn't mean that climate change and helping to create action on this global crisis is out for you. There's room for everybody.
That's right. You always say all hands on deck, right, Kristen?
All hands on deck, yes.
Over to you, Ernest Chow, with a question.
Hi, everyone. Thanks to the panel. It's tremendous to hear all your work, and so thank you. I'm not at all an expert, so I'm going to just ask a very simple question. I just didn't hear this. You know, I obviously want to focus on root causes and, you know, we're talking about air quality. At the same time, when there's an event, a fire, a dust event, you know, in these communities, in these schools, do they have resources? Like, do the kids have access to masks to wear to protect themselves, the families? Is that part of the program? You know, so what do you do on a day, right? And of course, if you have air conditioning, great. But if you don't, what do you then do? And you know, so I'm just curious: is that part of the landscape? Because if they're my kids, I put masks on them and say, okay, this is what we're going to do today. So that's just my.
Ernest, I might have missed it. Was this question specifically for schools?
For schools particularly, yeah. Obviously, you need to resource them. You need to have training. There's a whole system. You can't just, have.
Yeah, so there was a document put out by several state agencies a couple of years ago now that outlines basically response for wildfires in terms of level, in terms of AQI and measures that the schools can take. Because of the pandemic, many schools now have something in the form of filtration, whether it's in SFUSD, they bought a bunch of individual air filtration units for each classroom, because as I learned, only a handful of SFUSD schools actually have an HVAC system. So because of the pandemic, this issue was somewhat forced for schools to consider, but they're not long-term solutions. Like SFUSD can't rely on air purifiers in individual classrooms forever, for example. I actually got this question last year by the person in San Francisco that was trying to decide, because of the pandemic, well, if it's a really poor air quality day, we don't want them eating inside. They could, give the COVID to each other. So what they should just be eating outside, even if it's a really poor air quality day. And I was like, wait a minute, we have to think about immediate harm versus theoretical harm. And we need to be making those decisions in a little bit more rational way than always being scared of the theoretical harm. But these are all, these threats are evolving so quickly. And I think a little bit to the point that Kevin made, schools are looking for authoritative sources to be able to make these decisions. And I think we're getting there with those tools, but there's a lot of work to be done.
Gina, let's hear from you next, and then we'll take our final question, which is from Shannon. But go ahead, Gina.
Yeah, just to add that, the masks that are typically used for COVID are fairly inadequate for wildfire smoke. Even KN95s allow a fair amount of air around the edges because of their fit. And so a true N9 certified by NIOSH N95 respirator is what's needed. Those, unfortunately, are pretty uncomfortable to wear for long periods of time. It's doable, but it is a lot to ask. And they also are not typically available for kids in kids' sizes. And so, it is something to think about, and it's useful to have, I have my supply of true N95 masks, but same kind of thing applies for air cleaners or air purifiers, as they're often called. You have to make sure you've got the right kind and that it's up to the task, that it will clean the amount of air, for example, that you have in a large classroom. And many air cleaners, are either not sized for the space, and so they're not doing really enough to clean the air, or some are even harmful. These electronic air cleaners that generate ions sometimes also emit ozone as a byproduct, or other free radicals that can harm the lungs. So it's definitely an issue where you have to think hard about what you're doing. And then you get the right air purifier, in the air and in your classroom, and it's so noisy that people can't hear and they turn it off. So it's tough. I think, as Lisa was saying, we need a better long-term solution.
Thanks, Gina. Really important point. So we just have a couple minutes left. One last question from Shannon McDermott. I think I'll pose this to maybe either you, Kristen, or Lisa. Shannon says, thanks for these excellent presentations. What should health systems be doing to prepare for the climate crisis? So big question, but if you could answer it as succinctly as possible, we'd love to hear from you.
Sure. Health systems in recent years, especially since Hurricane Katrina, have done an enormous amount of work and investment in their preparedness and resilience efforts. The main thing that health centers or that health systems need to be doing is to be looking at the broader aspects of the climate crisis. So as an emergency manager, heat was always the boring emergency, right? Like it was just sort of there, it got hot, but it wasn't really a health system-wide emergency. That's a big failure. Heat is the biggest killer of all of the climate-related emergencies, and health centers are not recognizing that, right? The attention still goes to the dramatic things like hurricanes and flooding and all of that kind of stuff. So the first thing that health systems need to do is to recognize the full scope of the threat and see how is heat impacting the quality of the health in their people in their communities, air quality, wildfire, smoke, things like that. They tend to focus on physical emergencies that directly impact their specific facility, right? But you need to be thinking broader than that. So there is a terrific foundation put in place in the years following Katrina, but now it needs to be broadened beyond disaster preparedness into the larger climate crisis. The other thing is that the health system, these are some very, very powerful organizations, and they need to leverage that power into advancing public health and advancing health for their communities at large.
Yeah, I'll just plus one that I have a lot of thoughts about that. We wrote a piece about it in terms of heat and health system preparedness, but I just want to plus one, what the health systems need to do is invest in community resilience, because no matter what a hospital system does to prepare, if an entire community comes in because the power has been shut off, people don't have access to their medical life-saving devices, the elderly are entering heat stroke, there's no amount of hospital preparedness that is going to result in good patient outcomes. So we need to make sure that our community members are safe to prevent that from happening in the first place.
Thank you, Lisa, and thanks everyone. And please contact Americares or the Bay Area Global Health Alliance if you're interested in partnering with any of the institutions you heard from today, and we can explore advancing the dialogue on this important topic. But for today, on behalf of Sarah and the Bay Area Global Health Alliance, sorry for the technology problems, and Sarah wasn't being able to be seen and heard today, but both of us thank all of you for joining us and the fantastic panel. Look forward to continuing the conversation. Have a great afternoon.